Welcome back to Blood Vessels Part 3. So we just discussed how we can adjust our blood pressure higher or lower based on our neural input. Uh, we also said that higher brain centers can override it. Generally, that's going to be your hypothalamus. So the hypothalamus is important for multiple things. It is very important in controlling your autonomic nervous system, like your fight or flight, rest or digest, parasympathetic, sympathetic nervous system. So during stress, fight or flight, the hypothalamus increases your blood pressure. It also changes the distribution of blood flow. So when you're exercising or you're really warm, your blood goes more superficially. Whereas if you're cold, it stays more internally. You can also use hormonal controls to control your blood pressure. And that can be short-term by changing the peripheral resistance or long-term by talking to the kidneys about blood volume. Okay. So hormones, there are 4 that we will discuss shortly and how they relate to blood pressure. 3 out of the 4 cause increase in blood pressure. So if your blood pressure is low, these can work together to bring the blood pressure back up. So epinephrine, norepinephrine increase your cardiac output, your heart rate, and vasoconstriction. Angiotensin 2, after renin is released from the kidneys, causes vasoconstriction. And ADH is antidiuretic hormone. That causes us to keep more water and to vasoconstrict. When your blood pressure is too high, your heart cells release atrial natriuretic peptide. And what that does is it antagonizes aldosterone. So an antagonist messes with the main character of a story. So it messes with aldosterone. And what aldosterone does is tells your body to keep more sodium and therefore more water instead of making it into urine. So atrial natriuretic peptide comes in, cancels out the aldosterone, you lose more water as urine, and your blood pressure goes down. Long term, you regulate your blood volume at the kidneys. So our kidneys do that directly all the time based on the amount of pressure on the blood vessels there, and indirectly through hormones. Okay. So what happens when your blood pressure is high? The capillaries in your kidneys are under high pressure. That pushes more of the fluid to become part of urine, which then on its own took the increased blood pressure and decreased it. Oppositely, if your blood pressure in your capillaries of your kidneys is low, less water gets pushed into urine, so you save more. And as you keep more in your blood pressure goes back up. So that's direct. No sort of input there other than the pressure in the blood capillaries of your kidneys. So how do we monitor our circulation? Well, first you can take your pulse. At your pressure points where your arteries are close to your surface, you can feel your pulse. Oftentimes we'll take what's called the radial pulse, your radial artery at your wrist. There are the points where you can take the pulse most easily. These are arteries where they've got high pressure and they're superficial. So when you want to measure blood pressure, you measure your systemic blood pressure and you measure it at those external arteries. You do this by an oscillatory method. Oscillation is a listening. So you use a stethoscope and a sphygmomanometer. That is a blood pressure measure, the blood pressure cuff. So what you want to do is you want to put the blood pressure cuff above your elbow and put the stethoscope below it, right on the artery after the cuff. Then you pump up the cuff, you inflate until the pressure in the cuff is greater than the pressure in your artery. At that point, blood flow should be completely cut off. Then you slowly lower the pressure. And then once you reach your systolic pressure, when your ventricles are contracted and the pressure in your vessels is higher, blood will go through. So you'll hear these sounds of cork trough. And what that means is that you can hear like a poof, poof, poof. You can hear the blood going through when the pressure is high, but when your ventricles are contracted, the pressure isn't high enough and the blood doesn't go through. Then you slowly release the pressure again. And then once your pressure is low enough, you reach your diastolic. Blood is moving through the artery freely, and then you don't hear anything again. So when the sounds start, you've got your systolic, and when they stop, you've got your diastolic. So systolic is normally less than 120 millimeters mercury, and diastolic is normally less than 80. So if somebody says their blood pressure is 120/80, that's their systolic over their diastolic. When does your blood pressure change? It changes based on your posture, how much physical exertion you're doing if you're working out, also your emotion, and if you have a fever. If you have high blood pressure that's sustained 140/90 or greater, it's called hypertension. Hyper is high. High tension, high blood pressure. If you have elevated values but they're not quite that high, it's pre-hypertension. It'll put more pressure on your heart and your blood vessels if you have hypertension. It can lead to damage. It can cause heart failure, vascular disease, kidney failure, and a stroke. You can have that congenital heart failure. Your heart has to work harder, myocardium gets bigger, but then there's less space in there, so it weakens and becomes flabby. And that's going to be accelerated by atherosclerosis. That's when you have the fatty plaque buildup in your vessels. Hypotension is low blood pressure. And it's not normally a concern. Usually it's okay, unless you're not getting enough blood flow to the tissues and they're hypoxic. Otherwise, it's generally healthy. That's it for blood pressure. Have a great day.